Nick Ferrari at breakfast on LBC. Call 0345 6060 973.
7:49 the time. We'll come back to our conversation about Rwanda, but we will be moving in the next hour for more coverage of that nurses' strike. And on that subject, let's bring into the conversation Conservative MP and Health Minister Will Quince, who joins me now. If I can perhaps, Minister, show you some of the front page headlines this morning. The Eye, no guarantee of ambulance for stroke or heart attack. The Times, heart attack patients to be denied ambulances. The Guardian, ambulance strike threatens lives of 999 patients. The Daily Mirror, your working nurses to the bone. And the Metro saying that the condition is critical for the NHS as well. Can we last and for all now stand down the pretence that the NHS is safe in the hands of the Conservatives? This is nothing short of a shambles brought about by your administration, isn't it? Good morning.
Well, Good morning, Nick. It's nice to see you and hear you. Of course, those are front pages that no government minister or indeed anyone across the country would want to see. I think there's a couple of points there. The first is that the government accepted the independent pay review body recommendation for all Agenda for Change staff. So that includes nurses, paramedics and ambulance staff. We accepted those recommendations in full. On your points about the ambulance strikes tomorrow, I've been absolutely clear with the unions. The Secretary of State and I are meeting them again later today. There are local derogations that are happening at an individual level between unions and individual ambulance trusts, that life-threatening and emergency situations must be covered as part of minimum service level guarantees, and we'll be repeating that expectation later today.
Right. Back to my broader point, though, we have a second day of a nurses' strike. This is the first time in more than 100 years. We'll have more ambulance strikes later in the week. It's all on your watch. Morale is said to be at an all-time low. And your boss, the Health Secretary, was confronted, understandably, I would argue, by the concerned mother of a 3-year-old whose treatment has been delayed for 5 days due to a shortage of beds. So I put it to you again. Your stewardship as the Conservatives of the NHS has been lamentable. And instead of pointing to independent review boards or whatever it is, what do you intend to do to get these folk back at work and to provide cover for the people who pay their taxes to keep you and your colleagues in the positions you enjoy?
No, Nick, I completely understand that.
Well, what are you going to do about it, Minister? You're in a position of influence. I'm not.
No, Nick, you're right. And there is more money going into the NHS every year. In fact, there's more money going into our health system than ever before. This year, 153 billion. That rises to 166 billion next year. Those are just numbers, aren't they? Because rightly, as you say, it is patients and people up and down the country that expect the health service to be there for them when they want it. But pay is an important factor. And as I say, we did accept the independent pay review body recommendations in full. Of course, I don't want to see anyone within the NHS going on strike or pushing for industrial action. But at the same time, Nick, my door is open. The door of the Secretary of State is open to discuss working conditions and other issues that the unions say are important. But we have those independent pay review bodies for a reason. They made their recommendation. It's up to the government to either accept or reject the recommendations. In this case, the government accepted the recommendation in full. Now, what the unions are asking for, Nick, the RCN in particular, 19.2%, that's 5% over and above the rate of inflation. For some context, that's around £700 million for every 1%, equates to about £10 billion, which would have to come out of the NHS budget, a budget which you rightly point out, should be being spent on patients and patient care and getting down the elective backlog and waiting list that was largely caused by COVID. So the ask is unaffordable, Nick, and we accepted the independent pay review body's recommendations in full.
But the two parties are at either end, aren't they? I think most of my listeners would agree 19% is a lot to ask for at these times, but they would also say that sticking by this pay review board or body that you are clearly is not going to work. There has to be some kind of middle ground. Otherwise, we're just going to see more and more industrial action going into the new year.
Well, Nick, we have the independent pay review body recommendations for a reason. Last year, for example, they recommended 3%, which was over and above the rate of inflation, and at a time when the broader public sector was frozen. And that was rightly to reflect the fact. I'm full of admiration and respect for not just nurses, and this is another important point, Nick. It's not just about nurses. And I listen to your show, so I know some people have called in and questioned the numbers. Nurses, yes, there are 320 or so thousand, but actually this This is 1.245 million people who work under the Agenda for Change contract within the NHS. You can't just single out nurses or paramedics or ambulance technicians. This is all on the Agenda for Change contract. That's why it costs £700 million for every 1%, and why it's unaffordable. And then, of course, you've got the wider pressures that if you spend £10 billion additionally on pay, not only does that come out of our NHS budget, the money that we're rightly spending on tackling those COVID backlogs, it also drives inflation, which, as you know, Nick, makes us all poorer.
When you see the third paragraph of the story in the Times, an unnamed NHS ambulance chief says, quotes, "The best we can hope for, as regards the ambulance strike, the best we can hope for is that everyone stays indoors, no one falls over, no one gets ill, and no one has a car crash. People like you come into politics, credit to you, to try and make a difference, to help your constituents and to help other people." When you hear that from an NHS ambulance chief, surely you can accept, not you personally, but your team has failed.
Well, Nick, it is not the government that are calling the strikes. It's unions. As I say, we've accepted the independent peer review body recommendations. Well, yes, Nick, but we can't be in a position where every year we're negotiating with the unions and being held to ransom in this way. What is within my control, Nick, is because ultimately I'm the one that's responsible, is ensuring wherever possible we are protecting patient safety. That's why those derogation conversations are happening at a local level between trusts and the unions. It's why we've put in a MACA request, so Armed Forces personnel, 750 will be supporting ambulance trusts across the country. It's why we're increasing full services across the country, community healthcare, why individual trusts are block booking taxis. But the key, Nick, is this. If people have a life-threatening condition or an emergency tomorrow, it's really important that they call 999 as they would have done ordinarily. If it's not life-threatening and it's not an emergency situation, please call NHS 111 or NHS 111 online, and a clinician will be able to advise you accordingly.
So you, as a health minister, talk about this fiscal responsibility of you and your colleagues, and yet you'll be aware the government has launched legal action trying to recover around £122 million from a company linked to the Conservative peer Baroness Moon that awarded 2 PPE contracts. How come you can be so easy spending in those days?
Well, Nick, we were, as you know, at the height of the pandemic, and it was an international scramble for PPE equipment. A number of companies stepped up. There were companies as part of that where the contracts did not deliver. They didn't deliver. In this case, they didn't deliver because the quality of the products, in this case gowns, was not up to standard. We've been in a process of mediation. That hasn't worked. As you'll have seen from reports in the press, we have now moved to litigation. As it's now an ongoing live legal case, you'll understand why I can't comment on that. But yes, where there are cases of PPE or any other contract within our NHS that has not delivered, then we will first look to mediate, and then if that doesn't work, then we will litigate. Ultimately, Nick, it's public money, and I want to get it back.
Your colleague, the Health Secretary, Steve Barclay, went on a trip to a hospital in southeast London yesterday, and he was confronted by the mother of a seriously ill child who pointed out that the surgery for her daughter had to be pushed back by 5 days due to a shortage of beds. What would you have said to that mum?
I would have first said sorry, Nick, because I know the system is under considerable pressure. Bed occupancy rates are high. What we're doing this winter is adding an additional 7,000 beds, 2,500 virtual beds, and the remainder actual beds to. We're also
sorry. What's a virtual? My apologies, Minister. What's a virtual bed? A virtual bed,
Nick, is in effect being monitored from home, but with equipment and people going in to support you. There are lots of patients that don't need to be in an acute setting, but they still get the support that they would have done in a hospital. We've also put £500 million into adult social care to support discharge. A lot of it, bed occupancy, is we know there's about 13,000 at any one time bed occupancy where people are fit to be discharged, but there aren't necessarily the adult social care places. So that £500 million in effect purchases an extra 200,000 care packages. They're the measures we're taking, but I'm not going to pretend it's easy. I'm not going to pretend that it isn't difficult, and I'm not going to pretend that it isn't affecting patients across the country. So of course I'd have said sorry to that mother, and I know that clinicians and NHS staff up and down the country are working as hard as they possibly can. but the system is under considerable pressure. There's more resource going in. We have got a clear plan, Nick. But I think it's important that we're honest with the public about the pressures that the system faces.
So if we're under such pressure for clinicians and nurses, Minister, why do we pay the head of diversity £120,000 in one hospital trust? Is that more important?
Saw that.
Go ahead.
No, it's not, Nick. And I've seen that. I thought you might raise this, and I've seen that in that individual appointment, and I will be raising that with the chief executive of NHS England. Now, one of the things we do need to tackle, and I'm not justifying that particular role. I haven't seen the exact job spec. We do have to tackle recruitment and, importantly, retention. We do know that there are problems around retention. We know there are problems with bullying, harassment, and indeed racism within our NHS. They are things that we have to tackle. I would still question whether you need a manager on over £100,000 to undertake that role. So I'll look at that very closely. Ultimately, they're decisions for individual trusts, but I want to see NHS trust money being spent on patient care and roles that deliver that. So it's important that we question those roles where they don't stand as you say, the sniff test.
OK, last couple of questions. We know that the military are likely to be drafted in tomorrow for the ambulances, but it is reported that they won't be allowed to break the speed limit nor run through a red light. What's the point of having them?
Well, they're there for
well
contingency.
Cargo drivers.
Well, no, they're there for contingency. And look, I represent a garrison city, as you know, in Colchester, with the
indeed.
proud home of the Parachute Regiment.
Absolutely.
Our armed forces always step up when it comes to public safety.
I'm not disputing
they're doing
that for a moment,
in this case. They're going to
If
play an important role in contingency. So you're right, they're not going to be going through red lights. They're not going to be putting their blue lights on. But they're going to, because we can't have them breaking the law, Nick, and it wouldn't be right to ask them to do so. As much as some of my paras may like to.
Why wouldn't we ask these men and women to drive tanks to the Ukraine border, take part in all sorts of logistics? They are I don't need to tell you how well trained they are and how committed these men and women are.
They're incredibly well trained, but
they've
driving
got a bloke
an ambulance
dying in the back of the ambulance with a heart attack. They come up to a red light. Oh well, I'd better stop, Minister. That is a farce.
No, Nick, I hear you, but actually the expectation is that the emergency and critical incidents will still be covered by paramedics and ambulance staff as part of minimum service guarantees. The armed forces are there in a support capacity to drive ambulances. They're stepping in, but what we don't expect them to do. I mean, Nick, you've seen it. You're a driver. You're a driver yourself. Some responses to blue lights, ambulances, police are irrational at best. It does take considerable training. What we can't do is put either the armed forces personnel, those in the ambulance, or indeed the wider public at risk. I hear your point.
I'd back the soldier, sailor, or airman or woman to get me through every single time of the day, and twice on Sundays. I'd back that man or woman to get me through.
So do I, Nick. But I wouldn't want to put them in that position. They're there in a support role as contingency. We've got 750 of them, up and down the country as part of trusts. And I just want to put on record, Nick, my huge gratitude for them, particularly those who'll be working over Christmas.
I'm not demeaning
protecting
them.
The public.
I'm not demeaning them for a second. Lastly, Admiral Sir Tony Radakin, who I'm sure you know or know of, the head of the armed forces, says that you, not you personally, are using them quotes as an ultimate backstop. How fair is that criticism?
Well, I would much rather not be using them, Nick. I would much rather unions were not taking strike action. But as they are, my first duty is the protection of the public and patient safety. Our armed forces have always stepped up when the for public protection and other duties, they're doing so again. You know, do I hope that we won't rely on them in the future in the way that we do now? Of course I do. But while we have that need, I know that our brave servicemen and women will step up and fill those roles and support our ambulance trust, and I'm hugely grateful to them.
And I'm grateful for your time this morning. Thank you, Care Minister Health and Secretary Care Minister Will Quince, appearing here on LBC. We're at 2 minutes after 8. Let's get the latest news.
On your radio, on Global Player, and
Play LBC.
leading Britain's conversation. This is LBC.